Hello everyone, welcome back to Ra Online Education. I am Dr. Maheshwaran KS. I am a lecturer at Sri Ramachandra Faculty of Dental Sciences. And today we are going to be learning about vertical jaw relation in relation to complete denture. So the contents is going to include basically a definition of jaw relation and the types of jaw relation, followed by an introduction to vertical jaw relation. Then we are going to go into what is the purpose of vertical jaw relation, why are we doing it. Then we are going to see what is vertical jaw relation at occlusion, vertical jaw relation at rest, and what is the freeway space. Followed by that, we are going to see what are the factors influencing the rest position. Then we go into the methods of recording vertical jaw relation, where we'll be seeing the methods for VDR, that is vertical dimension at rest, as well as vertical dimension at occlusion. Followed by which we will be discussing what is the effect of an increase or decrease in vertical dimension of occlusion, and then we go to the conclusion. So, what is jaw relation or maxillomandibular relationship? We have already seen this in orientation jaw relation. It is nothing but the spatial relationship of maxilla to the mandible, which means the maxilla has one spatial orientation against the mandible. Why? Because it is a fixed bone, right? It has one three-dimensional spatial orientation against the mandible. Whereas, what about the mandible? Any one of the infinite relationships of the mandible to the maxilla. So, the mandible is a movable bone, right? It is basically floating in space with the help of a combination of muscles, tissues, ligaments, etc. We have already seen in mandibular movements that the movement of mandible is based on the temporomandibular joint anatomy, your muscles as well as the teeth, right? So this mandible is going to move against the maxilla in all three planes for us to perform the day-to-day activities like speaking, mastication, yawning, even clenching your teeth, parafunction, etc. Everything, the mandible is moving against the maxilla. So we need to record even this, okay? So in orientation jaw relation, we recorded the spatial orientation of maxilla in relation to the axis of the condyle using the Fezbo transfer, right? The Fezbo instrument, we used it and we transferred this relation to the articulator and we have articulated the maxillary cast. Now, we will go into vertical jaw relation. So, vertical jaw relation is basically defined as the length of face as determined by the amount of separation of the jaws under specified condition. So, simple, vertical jaw relation or vertical dimension is the length of face, that's all. We are just planning to determine what should be the correct length of face for that particular patient. Why? Because your complete denture is going to affect the length of face. So, we are going to just determine what should have been the length of face when the patient had teeth, okay? So, you have two types, vertical dimension at rest and you have vertical dimension at occlusion, right? So, one is maintained by occlusion of teeth while the other is maintained by the balanced tonic contraction of the opening and closing muscles of mandibular movements. The upcoming slides, I'll be telling you which is which. So, what is the basic purpose of vertical jaw relation? Like I told you, as patients age, they tend to lose their teeth due to various reasons like periodontal condition, caries, etc. Now, when they lose the teeth and when they do not replace them, you will find that this lower third of the face, the height of lower third of the face slowly starts reducing. Now, as they further age, as the bone keeps resorbing, as they further keep losing all their teeth, this height of the lower third of face is going to completely reduce, right? So basically, if you take the face, it can be divided into three thirds, one from the hairline to the nasion, from nasion to the anterior nasal spine or the base of the nose, and from there to the lower border of the mandible or the lower border of the chin. So basically, an ideally proportioned face will have equal thirds. You can divide the face into three equal parts. The upper and middle third we are not really bothered about because they are determined by a fixed bone which is not going to really change in the patient unless there is some kind of trauma, right? So the lower third is maintained by a fixed bone which is your maxilla and the movable bone which is the mandible. So when the patient tends to lose his or her teeth, definitely the lower third of face is going to reduce in height. If it reduces in height, the entire length of face is getting reduced. So that is basically the purpose of vertical jaw relation. We have to re-establish the length of face to what it was when the patient had teeth, Simple. So we saw that there were two types of vertical jaw relation, right? One is the vertical dimension at occlusion and the other at rest. So what is the definition of that? The vertical dimension at occlusion basically is the distance between two selected anatomic or marked points, usually one at the tip of the nose and other at the chin, when in maximal intercuspal position. This is the key words that you need to concentrate on, maximal intercuspal position. So when you bite, right, when you are biting, when you just clench your teeth, your upper and lower teeth is going to occlude, which means the jaw can not close beyond that point. Okay, you can open to a point, and when you close, when the upper and lower teeth meet, your jaw tends to become stationary at that point, right? So this occlusion of teeth is obviously determining the height of the lower third of face. So vertical dimension at occlusion is basically the vertical height of the face when your teeth are coming in contact. All of us have a vertical dimension of occlusion. All of us who have a full complement of teeth are going to have a vertical dimension at occlusion, that is dentulous patients. Now what about vertical dimension of rest? So there is one more vertical height of face. That is the postural position of the mandible when an individual is resting comfortably in an upright position. Now postural position is a key word. This vertical dimension at rest can be measured only when the postural position of mandible when an individual is resting comfortably. So right now I am resting comfortably in an upright position, okay, and I am looking straight forward, my eyes are looking straight forward. So I am in an upright position and I am comfortably seated. So when the patient is in this position, in this particular posture, then the mandible will also assume a certain posture. At that point, the associated muscles are in a state of minimal contractual activity. So at this particular posture, the teeth are not in contact. You will find a gap between the teeth. You will find that the mandible is slightly below the position of vertical dimension at occlusion. It is slightly below. Right now the teeth are not contacting. Now the mandible is just slightly floating in space with a minimal contractual activity of the muscles that are holding it. Okay, so you have two vertical dimension of the face. One is when you bite, that is one vertical dimension, and then when you are relaxed, your jaws are slightly falling down by a few millimeters, the teeth are not touching, your muscles are in a state of minimal activity, you are comfortably resting in an upright position. Now the height of face is going to be different. So this particular vertical dimension of rest is very important to us because the teeth are not in contact, which means it does not depend upon the position of teeth, neither the presence or absence of teeth, which means for completely edentulous patients, this vertical dimension of face is still present. Though they do not have teeth, they have muscles, right? And they can rest comfortably in an upright position. Hence, we have a vertical dimension of face that is still there, which is coordinated by your muscles.